Today we have Dr. Shivam Priyadarshi, and he is practicing in Jaipur. Well, one of the doctors we have in the house. So it is going to be very interesting to talk to him. We will be getting to know a lot of information from him. Of course, we're going to be talking about kidney stone management. Yeah?
Sure. Anything. Yeah.
Yes. So the first and the very important thing when we talk about kidney stones are the symptoms. As in, if I'm a patient, how would I know that I might be having a stone? Indicative symptoms actually.
Right. So usually these patients would present with flank pain.
All right.
It would be usually a colicky in nature pain, and then sometimes these patients may present with urinary symptoms also, and sometimes there may be hematuria, which is blood in urine. So all these three symptoms, and plus sometimes if the kidney, the ureteric stone is blocking the kidney, it may produce as a lump also. So as a swelling, hematuria, pain, and sometimes if there is infection associated, it could be fever also. So all these symptoms would suggest that the patient may be suffering from stone disease.
Well, we live in a country where every patient goes to the doctor when it's too late. It's already over the head. So I hope that you have already been to many of such cases. So would you please tell our viewers that any of such case wherein the patient came very late actually, and how did you tackle that?
See, many of these patients do come late because sometimes they would neglect pain.
Yes.
Sometimes there are stones which are so impacted that they would not cause pain. And if the patient doesn't go under asymptomatic. Yeah. So if the patient doesn't undergo a kind of a sonography anytime, so he might be having gross hydronephrotic kidney because of the stone, which is asymptomatic, and the kidney is totally knocked off because of the stone. So many such patients come to us who have almost a non-functioning kidney and then that condition, there is no other option than to do a nephrectomy in these patients. So it's very important that even if you have a little pain, you might better visit a doctor, and because ultrasound nowadays is just an extension of the physical examination.
Yeah.
So it can pick up many problems. So even the stones which are asymptomatic or they are not causing much symptoms, they will be picked up and should be tackled as early as possible.
Well, according to you, what is going to be the major breakthrough when it comes to kidney stone management domain?
We already have extracorporeal shock wave lithotripsy, which is kind of a in vitro kind of management for stone disease, where you do not have to do any kind of surgery. It is getting more and more advanced nowadays, and maybe we will be able to tackle more stones with shockwave lithotripsy. When we talk about minimally invasive surgery, the PCNL surgery, which is the major surgery which we do for renal stones, is getting more and more advanced in the terms that it is becoming more miniaturized. So we are having more and more mini PCNLs done, even micro PCNLs are getting done. So in that case, with a very, very small hole, we can tackle the whole stone. So that is probably with the more kind of instrumentation which are going to be advanced in the near future, we will be able to tackle all these stones in a very, very kind of a miniaturized manner.
All right. So when is the time when the necessary is the surgery actually, when there is no option rather than surgery? And is there any option when the surgery could be avoided when it comes to stone?
Yes. So if the stones are usually of small size,
yes.
Usually if it is less than 6 mm size, we will, if it is in the kidney, we will just give them a conservative kind of a therapy, more fluid intake, increased fluid intake, some kind of a medical treatment for the pain, etc., and will allow the stone to come out. There are a few methods of like percussion therapy, and even there are now, we have ultrasound machines which can just push the stone into the ureter and they can just get expelled. So we will try this medical expulsive therapy if the stone comes into the ureter. So if it is small, usually 6 to 8 mm, there is a 50 to 60% chance that the stone will come out spontaneously. And if it is a larger stone, definitely that requires.
True.
And then we have a retrograde intrarenal surgery, which is done through flexible uteroscope, pass through the urethra into the bladder and then to the ureter, and that is also getting advanced nowadays. So we have digital now uteroscope, where we can just fragment the stones with a laser, and all the stones can be just fragmented, and that is without even a small puncture also. So all these newer advancements will definitely help in the near future.
Wonderful. Yeah. So in the last, and the very important thing actually, we have a lot of myths when it comes to kidney stones. We have too much misconception. People say you eat this and the stone will pass out. So would like to burst any of them?
See, one of the most important myth is not to take milk. People think milk contains calcium, and they avoid milk. So that is a myth, because avoiding total restriction of milk will actually cause more stone formation. So because it helps to chelate with oxalate and produces more calcium oxalate, and that results in more stone formation. So always keep milk in the diet, but in moderation. It should not be in excess, but total restriction rather causes more stone formation. Similarly, fluid intake is very important. And fluid intake is not just taking 2 liters of fluid in one go. You have to take it at intermittent intervals.
There should not be a binge drinking.
Intervals. That's very important. Like if you are working, if you are going in sun, then you have to take a little more water. If you have fever, you take more water. After meals, about 1 to 2 hours, you should take water. Before going to bed, a little water. Just rising from bed, waking from, you take water. So at regular intervals, it's very important.
Wow, that was very informative. But thank you so much, sir, for being on board with us.
Thank you very much.
It was very amazing talking to you.
Thank you.
Thank you, sir.
Thank you.